Alright, so today we're going to talk about water balance and how your body regulates water intake and water output. So let's first start off with water balance. What water balance is when water intake and its metabolic production equals the amount of water that's output. And let's not forget homeostasis requires control of both water intake and water output. Now let's go ahead and start with water intake. So with water intake, the average adult intakes about 2,500 milliliters of water daily. 60% of this comes from drinking water or any fluid that you intake or consume, whether it be Coke, juice, water, anything pretty much. 30% of it comes from food, and 10% of it is a byproduct of oxidative metabolism of nutrients, or what is also known as water of metabolism. So essentially what happens is that your body loses at least or as little as 1% of its water level. That causes the osmotic pressure of the extracellular fluid to increase. And from there, that triggers the osmoreceptors in your hypothalamus, and that causes a person to feel thirsty and seek water. Once you go ahead and drink water, that results in the distension of the stomach, and your water is absorbed through your stomach and through your intestines. And as a result, your osmotic pressure in the extracellular fluid returns back to normal. So from here we can conclude that the primary regulator of water intake is through thirst. Now, water output. The average adult outputs about 2,500 milliliters of water daily. 60% of that is through urine, 28% of that is through breathing, 6% is through feces, and 6% of it is lost through sweat. Now, water output varies with temperature, humidity, and activity level, and can be adjusted if intake is changed. Now, there are two events that occur with water output, the first one being dehydration. The extracellular fluid becomes osmotically more concentrated. That triggers osmoreceptors, and the osmotic pressure is increased. From there, the osmoreceptors in the hypothalamus go ahead and tell the pituitary gland to release ADH. And what ADH is the antidiuretic hormone, and it's released into the bloodstream. From there, the blood carries ADH into the kidneys, and ADH causes the last part of the distal convoluted tubules and the collecting ducts to increase water absorption. And then lastly, urine output is decreased and further water loss is minimized. Now our second event is excess water intake. The extracellular fluid becomes osmotically less concentrated. This change stimulates osmoreceptors in the hypothalamus, and from there the posterior pituitary gland decreases the ADH release. So ADH is decreasing. From there, the renal tubes decrease the water absorbed in the kidneys, and urine output is increased, and excess water is excreted.